So your back flares up and the next day you're not sure what to do. Do you rest, stretch, push through it? The way you respond the day after a flare-up matters more than you think. Today I'm going to share with you the number one thing that you're going to want to do and what you should avoid. Hi, I'm Dr. Matt Bradbury, Family Corrective Chiropractor, and here we are at our practice, One Life Family Chiropractic here in Georgetown, Ontario, Canada. And today, I'm going to be talking about the number one thing you should do after a flare-up. Of course, if you're just tuning in, I love interacting with you. Take a moment. I'd love to see more of you and be a part of your health journey. So take a moment, make sure you subscribe and like so we can see more of each other. In the big picture, most flare-ups are increased sensitivity, not necessarily structural damage. And the muscles may tighten and the nervous system turns up that protection mode to help look after you. So the goal is to calm the system, not shut it down. And the number one thing is keep moving. Don't stay still and stop altogether. Movement helps reduce guarding, helps improve circulation, and helps keep your confidence up, which are going to be key things. So the best option is focus on walking. Focus on moving 5 to 10 minutes at a time, short increments, keeping your body moving, thinking groceries in, garbage out to help with the healing process. And you're not going to want to wait until you feel better to start this. You're going to have that little switch in your brain that says, I got this, keep moving because I want to do better for myself, but I want to keep up, well, with my kids, my grandkids, do life and be that much more resilient. And what not to do? Well, first of all, you don't want to stay completely still, and you don't necessarily want to be aggressively stretching into pain. And you don't want to go jumping right back in to maxing out all of your lifting right away. And remember, these things may increase irritation and could potentially delay your recovery. So you want to apply the concepts of relative rest so you can still keep moving your body, keep walking, keep moving. And when I say relative rest at the gym, you don't want to go maxing things out, but you still want to show up and you still want to lift some loads to help keep your body, well, things lubricated and keep you healthy and keep your brain in the game and your body in the game so you can maximize the recovery process. Remember, you're also going to want to add some gentle movement in. So if you're just getting started, some things that I would start with, movements like the cat camel, just like this. Flexion, extension globally of your spine. So getting some motion back in there. And for each set, I would do 10 to 15 reps, just focusing on you being the natural pump for groceries in, garbage out, to help well with the healing process. Movements like pelvic tilts would also be useful, where I just gently flex my abdomen, extend, and you'll notice here, I'm flattening out my low back, and then I'm going into extension. With this, you're just gently going back and forth, and you're working in that 12 to 20 rep range, or you can work for a period of time, 30 seconds, just gently flexing and extending your pelvis, and helping getting some motion back there to help improve healing. And when you take it one step further while you're there, well, remember, let your arms relax at your sides, and you can do two-legged, big toe down, just hip extensions, just like this. And with this, you're gonna work, well, you can work for 30 seconds again, or you can work in that 10 to 15 rep range, gently extending your hips, coming back down, and thinking increasing blood flow, helping with conditioning, and getting some motion back through your glutes and low back muscles to help improve your recovery and performance. Now remember, you want to focus on smooth reps. You don't want to force things. You want to be controlled, and you want to keep the intensity relatively low. Remember, this is just about small movements, helping you move better, and small things that you can stack up throughout your day to help get you moving and focus on walking and getting back to doing all the fun activities that you love to do. As you start to progress things, remember, you want to reintroduce some stability. What I would start with is just basic bird dog movements like this. Kick out, pause, and the whole time you're focused on keeping your core stiff, not letting your hips shift side to side, but keeping your pelvis level with the ground. I would do 6 to 10 reps on one side, and then 6 to 10 reps on the other side. And as you progress that, and things start to settle down a little more, you can actually integrate your arm as well. So left leg out, right arm up, and back down. And again, working in that 6 to 8 rep range. You can do all on one side, and then you can switch to the other side as you progress things and help, well, get those glutes firing, that low back firing, and reintroduce some stability. And as you're progressing, introducing some stability, I love this one. The side plank with the toe taps. forcing yourself to become a little bit unstable as you tap that toe back and forth. But you can start from the knee and you can do 20 taps, 30 taps. As you progress it, you can come up to the foot just like this. And again, you can do 20 to 30 taps on each side. And you may do 2 to 3 sets to help reintroduce some stability work and help to build you back up. But remember, start with the idea that less is more. Gentle movements like the pelvic tilt, the cat camel, before you start to progress to things like, well, the bird dog and doing the side plank with the legs straight. So you want to start with the knee bent to help start with an easier version and then progress it later on as you start to move better. Remember, one of the reasons why this works is because movement helps tell the nervous system that it's safe. Stability work helps to support the spine, and you help prevent that cycle of flare up, fear, and less movement. You want to help break that cycle and keep your body moving so you can instill confidence and keep yourself moving at your best. Of course, remember, some of the key things to keep in mind are that movement of your spine is vitally important, and that X factor, what we call that chiro factor, is often this thing. People have addressed all other wonderful things. But guess what? If your spine's stuck, it often keeps you in that protection mode where things are guarding. So oftentimes, sure, we will look at areas that people may feel, but we'll assess the whole system to assess proper, well, spinal motion and also how that nervous system is communicating. And oftentimes, if you're stuck, you may be stuck guarding and in that protection mode, that fight or flight. So corrective chiropractic may help actually put the brake pedals on, ease up on the gas, so that you can help get out of that protection mode, help yourself feel safe, and help yourself heal better so that you can do more. So consider the health of your spine and nervous system. And remember, the only way to know is to get tested to know what's going on the inside. So thanks so much for tuning in today. Really appreciate it. And of course, if you enjoyed this, I love being a part of your health journey. Make sure you subscribe and like so we can see more of each other in the future. And as I've shared with you in the past, we got a big mission in terms of helping people understand that their health is about more function and they need better spinal health, which is part of that equation as well. So take a moment. My only ask is take a moment to share this so that the word gets out and more people understand that. And if you're thinking about someone directly, please take a moment, grab the URL and send it directly to them so they get the benefit too. So thanks so much for your consideration. Thanks for tuning in to be a part of the journey today, and have yourself a wonderful day. Bye for now.